Hello everyone. This is Dr. Pankaj Tiwary, a practicing dermatologist from city of Patna and assistant professor in Patna Medical College Hospital. And I am talking on behalf of DermaVidya, an open access to dermatology world. Today we will be discussing on pigmentation and periorbital melanosis, a very common yet often misunderstood skin condition and characterized by dark circles under the eyes, which we commonly call as dark circles. In this video, we will deal with what periorbital melanosis is, will unravel its causes ranging from genetic predisposition to the lifestyle changes, understanding the condition and differentiating it other pigmentary conditions which are seen around the eyes like pigmentary demarcation lines, like acanthosis, like maturational pigmentation, like sun tanning, and will give you the clue to go through the diagnosing process, as well as will deal with the variety of treatment options available, and will also discuss the home remedies which are related with this skincare routine to the latest and dermatological treatments also, and will aim to provide you with the comprehensive insights with periorbital melanosis. Our goal is to debunk the myths and particularly around this facial melanosis, and will debunk the factual information giving you a clear understanding of periorbital melanosis. So you can join us to navigate the complexities of periorbital melanosis, empowering you with the knowledge to address these skin conditions very effectively. Now, what is periorbital melanosis? Periorbital melanosis or dark circles are brownish to blackish coloration of around the eyes, including the lower eyelid as well as sometimes the upper eyelid, and it can be seen in any individual, starting in the young adults, college going students, to those who are middle aged, even in elderly people also. So there are a lot of causes. The first one is genetic. You can see in different families the mother has dark circles, and similarly then children and her daughter also gets those dark circles. So genetic predisposition is very important. Lifestyle conditions nowadays, using too much of mobile, too much of screen time is spending too much of screen time by children and college going students, and then lack of proper sleep, that is very important, plus stress and allergy also. Atopic individuals, atopic dermatitis, patients suffering from atopic dermatitis or having a history of atopy, they also develop dark eyes. So, and there are some health related issues also, like people suffering from anemia and iron deficiency or other nutritional deficiency, they also develop dark eyes, dark circles. So the dark circles should be distinguished from other conditions in which there is darkness or pigmentation around the eyes, like pigmentary demarcation line. Pigmentary demarcation line are other distinguished demarcation lines, particularly present around the lateral part of these eyes in a very linear fashion and very well defined fashion. It is not like around the eyes like dark circles. Similarly, there is one called maturational pigmentation, which is seen around this lower eyelid also. This is seen in individuals beyond 40 to 45 and slightly obese individuals. Then sun tanning can involve whole of the face, but it is mainly seen over the forehead, and then their lower eyelids are involved. So looking at the changes and looking at the symptoms, you can distinguish dark circles from these other common conditions. Now diagnosing. So there are not very much any scientific investigation behind this diagnosis of dark circles. So ruling out these other conditions like pigmentary demarcation line, dark circles are mainly a very clear-cut pigmentation on around the eyes, below the eyes. So it is easy to diagnose patients of periorbital melanosis. Now going to the treatment options. So there are a plethora of creams are available, serums are available, but obviously those creams or serums which contain vitamin K, retinol, or there are some matrixyl products, they help in this pigmentation part. And then coming the laser therapy also. So laser detanning or depigmentation part also helps, particularly the 1064 anti-arc laser, that also reduces the pigmentation. And there are some other radio frequency, periorbital melanosis reduction part is there. You can, this radio frequency pads are available, which can be used for 20 to 30 minutes. And there are some other lasers also, some LED lights, they also help in this periorbital pigmentation. And there are some recent advances in cases of, like, if your patient is having some kind of depression also along with this pigmentation, what we call a tear trough, periorbital melanosis with tear trough, then there are dermal fillers which give you very good results dealing with those pigmentation as well as this tear trough. In home remedies, there are some effective home care products also. People can use some like cucumber or even the raw potato extract, and the juice of raw potato also gives good result in this periorbital melanosis. Similarly, cucumber and some homemade paste. Females use this kind of masks and paste in home, and they also give some kind of effect in this periorbital melanosis. Lifestyle changes is very important. If the melanosis has come with these lifestyle changes like less amount of sleep deprivation, or more of screen time is there, then you should curtail those things. You should take proper 7 to 8 hours sleep. You should keep yourself stress free, and you should avoid the screen time. That gives very good result along with the topical creams and serums. And you can also prevent also by just managing those lifestyle changes also, taking a good amount of sleep, good amount of water intake and healthy food intake, and curtailing the screen time. And there are some misconceptions also, like these dark circles cannot be treated. No, they can be treated. If you look behind the, even in people who have familial history, in them also this pigmentation can be treated, but of course they have to maintain those things. They have to maintain with this whatever their dermatologist is prescribing you. You have to maintain for longer duration if you have a genetic predisposition or you have family members in having same kind of dark circles. So I hope you've been able to see that overview of this periorbital melanosis in this video. And if you find this video useful, you can look out for more such videos on the site www.dermavidya.com. And as a doctor, my advice is to always seek with professional help. Do not use skin and hair products by yourself. Please get in touch with an expert dermatologist near you. Thank you.
For more such videos, visit or log into dermavidya.com.